At CRT 2014, 6 different papers were chosen as really being the top of the heap. And the impact trial submitters, the 6 first authors, were honored. I'm talking with one of those right now, Dr. Robert Jan van Geuns, and from the Thoraxcenter at the Erasmus Hospital, Rotterdam, the Netherlands. First off, congratulations, number one. This is, you're one of 6, and we're talking about the BVS STEMI first study, an everolimus-eluting bioresorbable vascular scaffold, and it's for treatment in patients with ACS, correct?
Yes, the patients we're treating with primary PCI, and they have been treated with a bioresorbable scaffold. That was something unique in the world. We started using BVS 5 years ago in the cohort A studies, and you have seen the results over the last years. Right. When the device came to the market in Europe in September 2012, we started to expand our possibilities. We came into more complex lesions, also some ACS patients with thrombus, but initially we excluded STEMI patients because we were thinking that that was a step beyond that. We had to get an in-between step. So after some experience in non-STEMI patients with a lot of thrombus, removing thrombus with thrombus aspiration, we decided that we could take the step to STEMI patients with thrombus loads as well. And these patients have been treated with the STEMI, with the BVS in a manner just like the non-STEMI patients. If there's a lot of thrombus aspiration, then some lesion preparation just to get a good idea of the vessel diameter. And I think that's the most important thing when we are treating the patients with STEMI with a bioabsorbable scaffold. That we should have a good idea of the vessel diameter. The vessels should not expand later on because you cannot overexpand the device beyond its limits.
Now, before we go on to specific data, describe the device. What's the stent look like? How does it act?
So it is a stent or a scaffold which is intended to keep the vessel open after a balloon angioplasty. And that's what it's in principle doing. What the difference is with the latest generation metallic stents is that the struts are as thick as Cypher Texas. So we're making one step back, but in the future is, of course, that this is going to be absorbed and disappears while the metallic stents stay there for permanent. So it's a little bit thicker when implanting it, but it is back to the times when we had Cypher and Texas with the same kind of crossing profiles.
And how long does it last?
The change in radial strength is happening after 6 months to 1 year. And after 2 years, most of the PLA, which is the polylactates, are replaced by new tissues, by glycanes and all the other materials in there. And you still see them at OCT. And finally, by 4 years, you see no remnants anymore.
So the data that you're presenting here, how many patients and what did you find?
So we started treating in the end of 2012 50 patients with the BVS in the STEMI setting. We have now just published in European Heart Journal the 30-day outcome. What I submitted for this meeting was the 6 months outcome of these 49 patients. And that was remarkable good. We had no scaffold thrombosis in these 6 months. We had no TLRs of these lesions. There was only a minor ones in the side in non-TLRs where patients had some event. All the other patients were doing great at 6 months.
Now, in terms of actually implanting these, is it at all tricky? Are these devices just as strong going in as a normal stent? Is it, do you have to be more careful when you're installing this particular stent?
No, what we know is that the radial strength is similar to the latest generation metallic stents. What is different is the crossing profile. So sometimes you have to prepare the lesion a little bit more, and especially in thrombotic lesions, you might be rather worried about distal embolization, etc. So we carefully prepared it with the smaller balloons and do the thrombus aspiration to be sure that we had no distal embolization more than what we have normally in STEMI patients.
So what's next? Are you going to continue following these patients? Are you going to be enrolling more into a longer trial? What's up?
Yeah, in our registry we are now up to 100 patients in Rotterdam. What is, of course, the next step is always a randomized trial. So the first patients have been entered in Spain in the Trophy 2 study, which is randomizing the BVS versus the science. And I think that will give us the true outcome. We're now more comparing to historical cohorts of these patients, but the best outcome, of course, if you have the randomized trial to indeed see that acute results are non-inferior. You should not have distal embolizations with with this larger device. And then in the long run, you will only see the potential advantages of this therapy.
Well, congratulations on the paper and on the work. I think it's going to be exciting to continue watching this.
It's a very exciting area, and keep watching these results.
And please make sure that you check out JICA Interventions, because they're the ones who have published the abstracts from the CRT meeting 2014. For Cardiosource World News, I'm Executive Editor Rick McGuire.